what we're doing here is answering some questions that our listeners have posted on Facebook, particularly about arrhythmias. So, Dad, let's start off with atrial fibrillation, because a lot of people ask about that. What's the cause of that, and then how is it treated?
Well, atrial fibrillation is something that is increasing more and more in this environment. In fact, many doctors have called me about their wives or themselves getting atrial fibrillation. And basically what atrial fibrillation is that the heart rate speeds up, it's irregular, and the pacemaker mechanism inside the atria or the atrium of the heart kicks off and it takes over. So instead of your normal heart rate being between, let's say, 60 and 80, now your atrial rate can go up much higher, and the heart rate can be 150, 110, 120, and it can be troublesome. And one of the reasons why we're seeing a lot more atrial fibrillation today is that we're seeing a lot more thyroid illness today. And a lot of it could be due to the electromagnetics. In other words, the Wi-Fi in the environment, the cordless phone, the cellular phones, because these frequencies are harmful. They can be harmful frequencies to the body. And when our glands take them on, or our heart can absorb the frequency, it can trigger an arrhythmia in the heart. So unfortunately, we're seeing a lot more atrial fibrillation today than we did 20 or 30 years ago.
Well, that makes sense, because the heart is an electrical organ.
Exactly.
And electromagnetics are certainly going to have an effect on electrical organs, like our heart and
right.
our brains.
Yeah.
So atrial fib is, would you say it's the most common arrhythmia?
Well, it's getting more and more common. I mean, atrial tachycardia is more common. It's a lot. In other words, it's a step below atrial fibrillation. It's not as virulent. See, the problem with atrial fibrillation, Drew, if it's in and out or if it's prolonged, the blood may clot inside the left atrium, because the left atrium, instead of having a synchronous contraction, it's almost like a bag of worms, so to speak. In other words, it's quivering, right? So when the atrium is quivering, blood clots can form, and that's why it can be dangerous, because a person can present with a stroke from what we call a clot inside the left atrium. If it flakes off and it goes to the brain, it can cause a devastating situation. So atrial fibrillation is not to be taken lightly. It can be very, very threatening to one's health.
Well, let's talk about first conventional treatments for it, and then more natural treatments.
Well, the conventional treatments are simple. The easiest treatment, if your left atrium is not significantly enlarged, is a cardioversion, where the patient goes into the doctor admits them to the hospital. You get a little IV sedation, and you get an electric shock to the heart. And sometimes we'll put people on medications that keep the heart rate regular. But a lot of these medications, unfortunately, like any medication, can have hazards as well. So if we do have to use medications, there's lots of medications we can use, but basically doctors tend to have a favorite choice, because they'll choose medications that might have less side effects, for example. I mean, there's all sorts of medications. I mean, there's like amiodarone, there's digoxin, there's high-class antiarrhythmics you can use. Beta blockers are good in atrial fibrillation. I had a lot of success with beta blockers. We even recently used grounding in people who had atrial fibrillation, and we found out that earthing and grounding tended to support the heart as well. So there's lots of ways you can treat atrial fibrillation, but if you do have it, the most important thing is you need to be under the care of a cardiologist, or at least an internist that feels comfortable taking care of atrial fibrillation. And
what about ablation therapy? I mean, I've had really good success, at least with hearing from my patients, that it's worked for them.
Ablation has received better and better tolerance over the years. When we first started doing ablation, when I was in practice 10 to 15 years ago, frequently you needed 2 or 3 ablations to correct the problem. Today, the ablations are better. Still, a lot of people need a second ablation, but some people do get corrected on one ablation, which is a very, very minor, electrophysiological, quote, surgical procedure.
Okay. Now, Dad, our listeners are pretty savvy here. They were talking about
savvy. I can tell you that for sure.
They are very savvy. They were talking about magnesium on Facebook here being good for arrhythmias. What's your take on magnesium, and also what form of magnesium would be best for arrhythmia?
Well, magnesium has a common relationship to the heart. It tends to calm the heart. And I really like magnesium. Magnesium is endothelial cell friendly. It acts like a vasodilator. Remember, high blood pressure is a cause of atrial fibrillation. And magnesium, it's amazing, but in some people, magnesium can lower blood pressure, which has a positive impact. So I really like magnesium. It's something that I personally take every day. And the forms of magnesium that I like the best are the Krebs cycle components, like the citrate, the glycinate, the taurinate. Now, my favorite magnesium varietal is an orotate. When I was at a CoQ10 conference years ago, the Australians were using magnesium orotate. And the reason why they were using it was that it drives ATP in a preferential direction. In other words, it supports the action of ATP, and ATP is the energy that we all need to thrive. So that's one of the reasons why I chose magnesium orotate in my magnesium varietals, because orotate is one of those components that is really striking in supporting the overall energy concept of the heart.
I'm Dr. Drew Sinatra.
And I'm Dr. Steve Sinatra.
And this is Be Healthistic.